Hey guys, so today we are going to see about the brain death evaluations. Before that, we should follow some criteria. The main thing is the body core temperature more than 36 degrees Celsius in 24 to 72 hours. Apart from the systolic blood pressure, you should maintain more than 100 mm of Hg, and sodium, calcium, glucose should be in normal range. Apart from who's those having a severe metabolic derangement, acid bases disorders, and endocrine issues, those patients you should exclude from the brain death evaluations. There are three ways to assess the brain death evaluations. The first thing is physical assessment. Second is apnea test. The final is auxiliary test. So under the physical examination, the first thing is central pain assessment. The central pain assessment is a way of giving pressure to assess the central pain. There are some areas in the body. The first thing is supraorbital notch. So you can give a pressure here and check the central pain. Apart from angle of jaw, the third is upper trapezius, like in the sternum area. These are the parts you can assess the central pain. Brainstem reflex. The first thing is cranial nerve 2 to assess the pupillary reactions. So if it is dilated and non-reactive, consider as the brain death as this part. Apart from second one is oculocephalic reflex. So this is, you can hold the patient eyelid and keep it open and turn the head one side to another side. Suppose if the eyeball is also not moving, you can consider as a positive oculocephalic reflex.
Cephalic reflex, you will observe that when you turn the patient's head quickly to one side, the eyes will move to remain fixated on one position in space. In patients with an abnormal oculocephalic reflex, you will observe that when you turn the patient's head quickly to one side, the eyes will remain mid-position.
Next is cranial nerve 8 oculovestibular reflex test. So in this test, you can take irrigation like cold water, put it into each ear, 50 to 60 ml of ice water. Suppose you are putting in right side of the ear in the irrigation, so eyeball will move. Which side you are putting the irrigation, that side the eyeball will move. Suppose if the eyeball is not moving, it's constant, so constantly seeing in this type.
Vestibular reflex, when you instill cold water into the otic canal, you will observe that the eyes turn quickly away from the cold water stimulus, and then turn slowly toward the cold water stimulus in a repetitive manner. Therefore, if you instill cold water into the right ear, the fast phase of eye movement will be toward the left side, and the slow phase of movement will be toward the right side. This is a normal physiologic response known as nystagmus. After instilling cold water into the ear, you may need to wait 90 to 120 seconds to observe for any response. For patients in which there is a lack of cortical response based on earlier tests, the brainstem may still be intact. When you instill cold water into the otic canal, if the brainstem is still intact, you will observe the eyes turn slowly toward the cold water stimulus. Therefore, if you instill cold water into the right ear, the eyes will turn slowly toward the right side. After instilling cold water into the ear, you may need to wait 90 to 120 seconds to observe for any response. If the brainstem of the patient is not intact, when you instill cold water into the otic canal, you will observe that the eyes will not turn toward the cold water stimulus. Therefore, if you instill cold water into the right ear, the eyes will stay mid-position. After instilling cold water into the ear, you may need to wait 90 to 120 seconds to observe for any response before concluding that there is no response.
And the ninth cranial nerve is loss of gag reflex by stimulating the posterior pharynx. Apart from cranial nerve, 10th is loss of cock reflex.
You will see that the palate will elevate. In patients with an abnormal pharyngeal reflex, when you insert a tongue blade deep into the back of the patient's throat, you will see no response by the musculature in the retropharyngeal area.
Cranial nerve 10 is loss of cough reflex by stimulating the ET tube. Apart from physical examination, the second part is apnea test. So before going to do, you should maintain PCO2 35 to 45, PO2 of more than 100, and pH is more than 7.35. So the PEEP in ventilator you should keep in 6 to 8 centimeter of water. Once that value is reached in normal range, you can do the apnea test. Then switch off the ventilator. Through the ET tube, you give 6 liter of normal oxygen O2, and if you are giving TPs, give to 12 liter of O2. So CO2 expected to rise 5 mm of Hg in every first 2 minutes. After 2 minutes, every minute 2 mm of Hg will rise. So after 5 minutes, so expected PCO2 is more than 60 mm of Hg, and apart from patient will get develop hypotension or arrhythmia. These are the apnea test positive. If suppose patient is on ECMO, what to do? You have to reduce this sweep as 1 liter or less than 1 liter, like 800 ml. Then you can perform the apnea test. The third one is ancillary test. So these tests to be performed in who those are chronic CO2 retainers. So first is can check the cerebral angiography to check the cerebral blood flow. Second, you can do in CT brain, and third is transcranial Doppler to assess the pulse wave. Finally, EEG to rule out the brain death evaluations. This is the criteria to evaluate the brain death evaluations. Thank you.